I will be discussing knee pain. We will begin with a brief overview of the anatomy and discuss some common causes of knee pain. Now let's look at the anatomy of the knee. I'll be referencing this right knee anatomy model and our human model. The knee complex includes 4 bones. The femur is the long bone of the thigh and articulates with the tibia or the shin bone. The fibula is this bone on the lateral or outside part of the lower leg. And the patella sits on top of the femur. The patella is also known as the kneecap, and it connects the quadriceps through the patellar tendon to the lower leg. Looking deeper into the joint, we see the meniscus cartilage. There is one on the inside or medial side of the knee and one on the outside or lateral side of the knee. With the human model, you would palpate it along the inside joint line or the outside joint line. Most references to torn cartilage are one of these 2 meniscus. The function of the meniscus is to disperse force over a larger surface area so there is not so much compression on the joint itself. The meniscus can be torn usually by trauma of a rotational force. The meniscus can also be injured through degeneration with age. Without a well-functioning meniscus, the articular cartilage, which lines the joint surfaces of the femur, the tibia, and the underside of the patella, seen here in blue, can become injured or worn out due to excessive forces. When this cartilage degenerates, it leads to chondromalacia, or pain around the kneecap, or arthritis. Arthritis and chondromalacia are degenerative conditions and occur as we get older and develop excess wear and tear on the lining of the joint. The major ligaments of the knee include the medial collateral ligament, or the MCL, the lateral collateral ligament, or the LCL, the anterior cruciate ligament, or the ACL, and the posterior cruciate, or the PCL. The MCL provides stability to the inside of the knee and prevents the lower leg from coming outward excessively. The LCL connects the femur to the fibula and prevents the leg from coming inward excessively and provides stability to the outside of the knee. The ACL and PCL provide rotational stability of the knee, and the ACL also prevents the tibia from dislocating forward, like this. The PCL provides stability from the tibia dislocating backward. One knee injury that is common throughout the age and activity spectrum is patellofemoral pain, or pain around the kneecap. Due to stresses placed on the kneecap, pain can occur behind the kneecap, giving a sense of diffuse, deep pain around the knee. This is usually due to chondromalacia. Pain can also occur at the patellar tendon. This is known as patellar tendonitis, or the quadriceps tendon, known as quadriceps tendonitis. In physical therapy, we often address flexibility around the knee to decrease tension around the kneecap. We also focus on strengthening the muscles of the hip and butt to help control alignment of the femur. As the leg goes down, stress can be placed on the knee if it's not in alignment. When the muscles of the hip and butt are weak, the knee can cave in, placing extra stress on the kneecap. If you're experiencing aches or pain in your knees, there are things you can do to decrease your pain. Ice or cold packs are a great modality to help decrease pain and inflammation. There are specific exercises that you can perform to help improve the mobility of your kneecap and improve lower extremity flexibility and strength. If you continue to experience pain or problems in this area, then physical therapy may be your best option. Physical therapy is a safe and effective way to treat knee pain. Physical therapy consists of hands-on treatment to loosen muscles and improve knee mobility, instruction on stretching and strengthening exercises to restore muscle balance, education on proper movement patterns to decrease pain during walking, squatting, stairs, and running, and modalities such as ultrasound, electrical stimulation, and ice to help decrease inflammation. If the information and exercises provided on this website are not helping and you continue to have pain, please call our office for a free consultation.